The Chihuahua was turning blue. The tongue was blue. It was gasping for breath. I'm like, whoa, this is an emergency. And the owner was like, 我的狗这里有一个 lump. It felt like fatty lump. Can you please remove? It's very ugly. So, sorry, auntie, your dog is, I think, dying. I need to do x-ray to check the heart and the lungs. Yeah, but after that, can remove the fatty lump or not? Can remove the lump or not? Very ugly.
Hi, I'm Dr. Jean. I've been a vet for 9 years. I've been working at Star's Veterinary Clinic.
Hi, I'm Dr. Forrest. I graduated as a vet in 2005 and I'm currently working at Happy Vet.
What led you to where you are today?
I guess I had many things I wanted to be when I was young. I think that the medical field stood out the most.
As a kid, my younger sister was actually asthmatic, so I didn't get to keep any furry friends at all. So I caught spiders and lizards, and these were my pets. I actually had this furry keychain, you know, like those you clip on your back. And then every night I'll pray, transform this into a hamster. I always had this affinity for pets, and I just always wanted the best for them. And being a vet, you know, we can really contribute to their welfare, which is why I became a vet. Today, we'll be sharing more about our experiences and why we became vets. Veterinarians are basically doctors who couldn't make it into the medical school for humans. I graduated from the University of Melbourne, and during my time it was harder to enter vet school. So there were some people who couldn't make it and they went to the other side. To all the kids out there, if you want to become vets, you've got to study very, very hard. We actually do a little surgeries on like guppies and goldfish, all the way to the big ones. We do with elephants as well.
It's a very different ballgame. You kind of have to be a jack of all trades as well. You do need to know how to do dental, you need to know about skin, heart, you need to do your own x-rays, ultrasound, and then you multiply that by multiple species. Do you feel that one can only be a good pet owner if they have certain financial capabilities? Just like having a child, one must be prepared for multiple financial commitments ahead of them. They can get sick just like children do. Yes, it is important to make sure that we do set aside a little bit for them to make sure that we can help them as if they were our children.
Animals don't have MediSave.
They don't have MediSave.
So their medical bills can be...
Yep.
Yeah, quite high.
It can be, as well as that the vet clinics are not exactly, private veterinary clinics are not subsidized. We've had multiple cases that perhaps emergency surgery was required. Some people, they did not have the financial capabilities to be able to do surgery for them. And yes, I've had requests for euthanasias before. Euthanasia is a really, really big decision. No vet goes to vet school wanting to put down animals. In those situations, we actually did manage to rehome quite a few of those cats.
Getting good at this, man. It is easy to tame a pet. Just feed them food or treats. Not true leh. Some of our local Singapore special stray dogs and the stray cats, they have a bit of a wild feral instinct to them.
I think people who work with me know I have a lot of scars on my hands. My in-laws then thought that I had some sort of skin disease.
Just last year, I was attacked by a very fierce dog. It bit here, and the doctor told me that if it went a bit closer, where the nerve and the tendons were running here, my finger could be permanently paralyzed like that. So I opened up, I was like, wow, piang eh. I had to walk to the sink very calmly, and I was walking, you can see the blood trail, like murder scene like that. Oh. So I put under the sink and go like, wow, very
painful.
So I open and go, very pain.
Tell us about an experience you've had with an unreasonable pet owner. There are so many experiences for that. Where do I begin? A long time ago, I had this patient. It was a very young cat. It came in for vomiting. It had certain scratches in the mouth, like looking like something had pierced through them. The very, very first reasonable thing after finding out that the pet has a painful abdomen is to do an x-ray. The owner was, no, I don't want to do x-rays due to financial reasons. So I told her like, look, today I'm not going to charge you the consultation price. I want you to use that consultation price, take a cab to SPCA, because she had mentioned that she was thinking about going to SPCA. And she was like, no, but that's too far. In general, we get clients who want things that are cheap, that are very good, and as convenient for them as possible.
I had this owner, this Thai owner. She carrying her little Chihuahua come in the clinic. The Chihuahua was turning blue. The tongue was blue. It was gasping for breath. I'm like, whoa, this is an emergency. And the owner was like, 我的狗这里有一个 lump. It felt like fatty lump. Can you please remove? It's very ugly. Sorry, auntie, your dog is, I think, dying. I need to do X-ray to check the heart and the lungs. Yeah, but after that, can you remove the fatty lump or not? Can remove the lump not? Very ugly. Okay, we settled the animal dying. I saved the animal first, okay? So we X-ray, heart failure. Heart was not working, terrible heart murmur. The lungs were filled with fluid. No wonder it was turning blue. So we went up to this Thai. I was like, sorry ma'am, your dog is dying. His heart is failing. We need to hospitalize it. Yeah, but after that, can you remove the lump? Very ugly. And the lump was a fatty lump. It was benign. It was not causing any problems. The only thing was cosmetic. We still are professional. We managed to save the dog and we did remove the lump at the same time.
Yeah. That some pet owners just shouldn't be owners.
Yes. I would love to be politically correct. I mean, I have amazing, wonderful owners. But there are a couple of owners that, no.
Okay. Vets would like to make the pets get as many unnecessary medical treatments so their owners would have to pay more. Yeah, you all make us sound like some... As vets, our hearts are for the animals. We usually put ourselves in the owner's shoe. The question I'll ask myself is, what would I do if this were my pet? So if I feel that I want to run all these blood tests to get an answer, I would recommend it to clients.
What are the differences between house calls and clinics? Really good question. I think you got the correct vets to answer this. For house call vets, it gives the opportunity to visit these animals in a very much more comfortable space. For many conditions that can actually be really good. There are still certain things that I would say still needs to be done in the clinic. I think that, for example, if an animal has a broken leg and it needs, for example, an X-ray, you wouldn't happen to have any portable X-rays around, right?
I would say go clinic. Don't even bother calling me in. Don't waste money. Okay, what are some common struggles you face daily as a vet? Wow, not enough time, personal time. We work very hard. Like tonight, I will finish work about 12 midnight or 1 a.m. It's very common. Even as much as we try to help as many clients as possible and pets, we still have to turn away. I think during COVID, the population exploded.
Yep. COVID boom.
COVID boom, suddenly so many animals, but I mean, you have to study 5 years to go through vet school, right? You can't suddenly just boom the vet also, right? So I think all the clinics are overwhelmed. So personal time, sometimes just having to say no so that I can sleep at 1 a.m. in the morning. Because as a vet, right, you really just want to help every single animal out there. It's just our nature to love, Have you ever had to put down your own pet? Wow, I hope never. As in put down my... Yeah, no, I cannot. I cannot do any procedure on my own pet. I think I'm too emotionally involved.
Yeah, I mean, that is very, very rational and understandable.
I think if I have a pet, I bring to gym better.
No, don't make me do it. Yeah. As a vet, when you talk about putting down on euthanasia, you will think about from a very objective point of view, because you have to be objective because the clients won't be.
I think it's also important to know that we are pet owners also. So we exactly know where other pet owners stand. I always tell clients, I know if you let your pet go, and I know it's not easy. Yeah, I'm here with you. I'll see you through it because I've been there myself also. Yeah. Don't cry. It's okay.
Have you ever been to a friend, family's member's house casually and noticed their pet was not behaving normally? Probably not. But I've had acquaintances who are the typical send you a photo of a vague part of the skin and tell me, what's wrong?
Actually, I'm very scared at social settings, like wedding dinner. Like the moment I say a vet, I know I'm going to get a crowd. Oh, you are a vet? Come, let me show you. My dog like that. Hey, like that, how? How? Then I'm like, I eating there like. Ayo, have you ever gotten emotionally attached to the animals you eventually had to put down? Yeah, of course. Of course. Some of the hardest to put down are your patients which you see from a puppy, then grow up. Really every time I have to put down an animal, there is a sadness in here also because you know what the owners are going through. I kind of cry with the clients also.
That's one of the hard parts, that you see the pet go up and down and you see how the owners love the animal so much that they have been with the pet up and down. Sometimes we do cry with the owners. We do try to be objective, but you know, it's really not easy, especially if you've seen this pet since young.
What keeps you guys going?
Love.
I think it's remembering that you are here to do what the pet needs, that these pets do need saving. The next case needs you to make sure that you do what's the best for them and try to save them. It's got an ominous skull. Demonstrate to us how you would win the heart of a pet. Are you gonna be my pet? Are you gonna be my patient? Okay.
Dog or cat? Dog or cat?
Let's do dog lah. Okay. Hi Baba, how are you doing today? So, you're looking a little bit scared here. Let's just let you walk around while I talk to your owner on what's going on. Anything that I go through them has to be small. So for example, if this was my stethoscope, has to go near them slowly. You want to smell? Baba? Oh darling. Oh. And if you're just here for the vaccination, would you like a treat? And I get a treat. Okay, I'm sorry I had to do it. Okay, you've been such a great patient. So yes. So slow and steady, trying to see how the patient reacts. Not all patients are going to react like that, but yeah, you just see case-to-case basis.
Are there any unethical practices in the industry you do not agree with? For me, it's convenience euthanasia. There are cases which I turn down the euthanasias and the owners actually tell me, it's okay. If you don't do, I know of people who will do it. I feel very sad when I hear things like that.
I had like this pet that came to me. It was a Shih Tzu with really bad skin disease. The owner admitted there's nothing wrong with the pet except for the skin disease, but she wanted to put the animal down. Of course, I kind of like told her that, come on, you can't, and I gave her a whole lot of reasons why. And I told her that, why don't you consider rehoming the patient? She didn't want to initially, but because in my mind I was thinking like, oh no, is she going to go to another vet to try this out? So I sent like an email. At that time there was fax, so we sent fax as well to like all the clinics in the West. At that time I was working in the West to say like, there's this owner with this patient name that wanted to do a euthanasia, but there's not legit and everything. So I guess that I kind of think of it now with a little bit more experience. I know that most vets will not do it.
What's the bottom line?
I had a request for an owner to ask me to say that, look, can you just make it look like I sterilized the animal, but I actually didn't. So he just wanted me to make an incision and make it look like a surgical scar, which of course I rejected. So I think that those kind of things, you're putting through the animal through unnecessary pain. I don't think that it's right lah.
Why be a vet and not a doctor? My grandmother asked me this question actually. I just really just love animals. I think being a vet is a really undervalued job. Maybe Gio will start. I have a lot to say, but I cannot find the words.
I have wonderful clients who really appreciate us, but definitely there are going to be a lot of times where a lot of people they don't trust your motives. To just help a pet, you have to go through a lot of grief with the owners just to try to get the right treatment for the pet.
We are doctors lah, we are not God, right? If we can save everything, of course we save everything, but a disease is a disease and there's a natural progression and every pet eventually has to die. Some owners get very upset when you tell them, your pet is dying. They're like, why can't you save my pet? You go to medical school to save lives, right? We are humans also, we are not God. Yeah.
How was the experience?
It was fun. All these questions, quite interesting. It kind of provide an insight to me as well, asking myself these questions and having to think through them.
Thanks for watching For Real For Real.
If you want to see more, don't forget to like this video and to subscribe.
Bye-bye.